Okay, now we're going to go over what does it mean to do physical activity. Studies of benefits of exercise show that as little as 5 minutes of walking can improve high blood pressure as well as improve depression and chronic pain. Physical activity can be simple activities such as walking from one room to another, strolling out of the garden, helping with simple household chores, etc. To be beneficial, physical activity does not have to be lengthy and difficult or painful. Why does Rise Paradise want residents to have regular physical activity? Well, when anyone does physical activity, our brain releases endorphins, a special chemical that helps us feel good. It helps decrease depression, helps keeps us feeling energized and motivated to enjoy our day. The same process occurs in elderly residents when they feel better when they do a regular activity. Everyone has experienced that we quickly lose our muscle strength if we remain in bed or are inactive for even a few days. Elderly people lose their bone and muscle strength even more quickly if they remain inactive. By encouraging and assisting our residents to do exercise, we're helping to prevent their muscle and bone loss. We are helping them to improve their blood pressure, the circulation, decreasing any depression, helping them sleep better, and helping prevent any skin breakdown. Physical activity is also valuable for managing difficult behaviors in dementia residents. If a resident is agitated or unhappy, physical activity is a good method to redirect them and calm them. Just like ourselves, our residents can feel a sense of accomplishment and are mentally peaceful after physical activity. Repositioning and transferring of residents from one surface to another. Why is this important? Before I go through this slide, I want to reiterate to you that it is important for you to transfer the resident from their wheelchair into a regular chair. This should be done at all meal times or even when enjoying an activity. Why? Because you're relieving the pressure points from where they're sitting. If we keep them sitting in the same spot all day long, they're going to be prone to a skin breakdown. Even if you have a resident sitting on the sofa for a long period of time and they're not moving or repositioning, you are posing them at risk for a skin breakdown. So now let's go through the slide. Older adults often have poor circulation. When they sit and remain in bed too much, their blood may not circulate well. In addition, many older adults are thin and don't have much fat padding on their arms and their legs and their buttocks. They may have bony areas such as their hip areas, tailbones, heels, elbows, etc. that can rub onto the beds and chairs. By lying and sitting for prolonged periods of times, it's easy for their skin to develop pressure sores on these bony areas from poor circulation and pressure from lying and sitting. Our residents, clients, because of the dementia, may not be able to reposition themselves necessary. Any active, healthy person changes position several times an hour. Pay attention to yourself. Even if you're reading or listening to this short education lesson, without really thinking about it, you're frequently readjusting your weight and pressure from one leg to another, from one buttocks to another, moving your arms and shoulders, etc. These frequent adjustments in your position help maintain your circulation and prevent any pressure sore from developing on your body. We need to help our residents and clients keep physical activity and assist them moving and readjusting their position frequently. What is proper technique for assisting our residents in transfer and reposition? Rise Paradise always wants our associates to be safe and not injure themselves while assisting our residents. If a resident's too heavy or uncooperative, seek the help of an associate. Good body mechanics can help make a transfer or repositioning comfortable for our residents and clients as well as safe for our associates. To transfer the resident from one chair to another. So as I explained earlier, explain to the resident what you are doing. Ask the resident to assist as much as possible. Secure your footing by standing within feet of 8 or 18 inches apart so you have a good base support. Use large muscles to lift the resident or client. Use your muscles or the thigh muscles in your shoulders, arms, and hips. Do not bend and use your back muscles to lift. By bending your knees and using your thigh muscles to lift, you can protect your back. It may help to stabilize the resident client if you put one of your feet between their feet and hold them close to your body. Rotate slowly and even toward a new chair location when you want the resident client to sit down. Often residents and clients are able to assist with the transfer. If the resident can stand with assistance and put weight on their two legs, don't miss the opportunity to try to get them to take a few steps before you sit them down again. What happens when people don't remain physically active? Well, if we allow our residents to remain physically inactive, they will rapidly develop other serious health problems. The other health problems that our residents are at risk for is the inactive include depression, weak bones, increased risk of fracture, disturbed sleep cycles, increased pain, and problems with circulation and diabetes. Because of their dementia, many of the residents' clients do not reposition themselves on a frequent basis. Because of the sustained pressure on certain body areas, they may rapidly develop pressure sores on their tailbones, hips, heels, elbows. In as little as 2 hours, a resident or client can develop a serious wound on a bony area from pressure and lack of circulation. By keeping our residents and clients active, we are giving them the gift of good quality of life. If everyone's responsibility to help our residents' clients remain physically active as possible, ask your residents, clients to dance, walk, and golf, swim, and throw a ball. Everyone can exercise. I want to go back a little bit on the part where it says that residents can develop a bad sore due to a lack of circulation. So when a resident is sitting in a spot for too long, again, maybe sitting on the sofa or sitting on the chair because that's where they want to be. If a resident has other conditions such as diabetes, if they develop a pressure sore, that sore is going to get bigger and bigger, and it's going to take a long time to heal. Somebody with diabetes has very bad circulation. Therefore, the blood is not flowing through the body as it should. And so the resident who has diabetes and develops a pressure sore, it's going to get worse, and it's going to take a long time for it to heal. So it causes more and more problems. So keep in mind, the more you move the residents, the better it is for them and the easier it is for you. Let's keep our residents active as much as possible. Transferring them from their wheelchair into a regular chair or the sofa or recliner is much better for them. The little few steps that they can take every day is much, much better for them.